Hi, my name is Dr. Miaga, intern psychologist at Central University of Technology, Welcome Campus Wellness Center. Today, I'll be presenting to you stress related to COVID-19. The outline of my presentation is as follows. First, we're going to look at the introduction on COVID-19. We'll also look at challenges in relation to COVID-19. Then we're going to look at stress and COVID-19. And lastly, we're going to look at coping strategies on how to cope best with stress. The introduction. COVID-19 being coronavirus disease 2019, a novel virus that was discovered in China, Wuhan in December 2019. Coronaviruses are specific subtypes of viruses that have unique characteristics as many viruses do. For instance, they use RNA instead of DNA as genetic material. They are covered in spikes and they use the spikes to invade cells. Those spikes are the corona in the coronavirus. Coronaviruses affect your lungs as well. That is why people struggle to breathe when infected, and symptoms range from dry cough, sore throat to pneumonia. Some people have mild symptoms, some moderate, others severe, requiring hospitalization. COVID-19 presents a significant social, economic, and medical challenges. As we saw, our health system in South Africa struggled with containing the surge of cases requiring hospitalization. Of most importance, COVID-19 has already begun to precipitate a huge increase in mental health problems, ranging from mild to severe psychological changes, and this would be the focal point of my presentation. Now let's look at challenges within the higher education sector which are in relation to COVID-19. Now let's look at challenges among students. Firstly being the shift from face-to-face to online classes. This came with a huge challenge for students. For instance, having the right device to connect, having data bundles or Wi-Fi connection to stay connected, and also having the conducive space to be able to study. Secondly, online assessment and evaluation, which I think was a big challenge for the lecturers because they were not able to assess whether the student actually took the online test or asked someone on their behalf to take it. Thirdly, inequalities among student population in higher education institutions. Some institutions, as we saw, were able to provide students with devices, some were not. This revealed the gap between the haves and the haves not. International students, travel restrictions was imposed, therefore they were not able to study in their respective institutions, and this was done to curb the spread of coronavirus. Now let us look at related stressors. Firstly, the worry about economic influences. Students could be asking themselves, am I still going to get a job with the qualification I'm studying? Secondly, the worry about academic delays. They could be asking themselves that when will I finish my studies? Thirdly, disrupted social lives. For instance, students are living with their parents instead of living alone at a rented place or university residence. This might negatively affect their developmental milestones, like the independence in sexual relationships, expression of sexual and gender identity, the ability to engage or not engage in spiritual, religious, and political affiliations or other pursuits of choice. Fourthly, worry of being infected or infecting others. Lastly, fake news, 5G and vaccine. People are now worried whether or not to take the vaccine. Now let's look at stress and COVID-19. Complex stress. I use this term to capture the symptoms that most people are going through, which could include acute stress, anxiety, post-traumatic stress, grief, and depression. Stress is defined as a physical and psychological responses that occur when situational demands outweighs one real or perceived resources to address those demands. For instance, when people think that they are unable to do certain tasks because those tasks have placed great demand upon them, they could be thinking like that because they are stressed. Stressors could include a range of life events, physical factors such as hunger, flu, pain, environmental conditions such as crowded places and places that have high crime rates, personal thoughts such as thinking that I am not good enough, I'm a failure, therefore I cannot be able to achieve anything in life. And for me, those are the most devastating stressors that one can place upon him or herself. Types of stress. There are two types of stress mentioned: distress and eustress. Distress being the bad stress, stress due to an excess of adaptive demands placed upon us. The demands could be so great that they lead to bodily and mental damage. For example, unexpected death of a loved one. Some people could require professional help in dealing with grief. Eustress, the good stress, the optimal amount of stress which helps to promote health and growth. For example, praise from a superior for hard working. Understanding stress in a simple cognitive behavioral model. Let's say there was this event that placed huge demand upon us. Firstly, we're going to perceive the event, our own thoughts and perception, how we see the world to be, and or how we see the event to be. Secondly, we're going to have an emotional reaction in line with our thoughts. Our thoughts affect our emotions, and our emotion affects our thoughts as well. Lastly, we're going to act out the behavioral change, which also is affected by our emotions and which also affect our emotion. So what does this mean? It simply means that it is not what happens to us that make us act out, be angry, sad. It is the thought or perceptions we have regarding the demanding event or stressful situation. While we cannot control what happens to us, we can master how we experience it. We are always going to encounter stressful situations in life. That's inevitable. However, we have to be careful about the perceptions we make on the event that happens to us. For it is not what happens to us that makes us angry, frustrated, overwhelmed, worried, and sad, but it is the story we tell ourselves about what happens to us, which leads to how we feel and how we behave. On the previous slide, we talked about how do we get stressed. Now let us look at what happens when we are stressed and why does it happen. Firstly, we experience physiological changes such as increased heartbeat. Why does this happen? It's your heart pumping more blood to the muscles so that they can work better in fighting or running away. Secondly, there's increased breath rate. This happens so that more oxygen can be drawn into the lungs to be sent to the muscles. As we know that oxygen helps muscles to better function. Thirdly, increased activity in sweat glands. This is to protect the body from becoming overheated. Fourthly, thinking processes temporarily shut down. This helps you focus on what you need to. Can focus your attention and concentration, for instance, on how to avoid or vanquish the threat. Fifthly, the increase in pupil size. This helps to expand your field of vision so that you can better see the threat. Digestive system, lastly, temporarily shuts down. This is when the blood is rerouted to muscles and it is often experienced as butterflies. Now let's look at more symptoms of stress, starting with physical indicators, secondly, emotional indicators, and lastly, behavioral indicators. Physical indicators. Most people get trembling hands, they become stiff and tense, especially around the neck and shoulders. They develop headaches or eye tension. They experience shortness of breath. They experience an upset stomach, dry mouth and throat, need to urinate often. Emotional indicators now. As I've previously mentioned that it is not what happened to us that make us nervous, angry, frustrated, overwhelmed, but it is the story that we tell ourselves about what had happened to us. Emotional indicators, most people feel anxious, they can feel angry, irritable, frustrated, excessive worry, being overwhelmed, and sad. Behavioral indicators, which are also in line with emotional indicators. For example, a person who feels nervous and anxious can become withdrawn. Anger could become short-tempered with others. Uh, they experience changes in their appetite as well. They're less interested in sex. They sleep too much, not able to sleep, or take more medication or substances as a result of trying to cope with the stressful demands. Now let's look at coping strategies. The first coping strategy would be to normalize the psychological response. An abnormal response to an abnormal situation is normal. Remember, this situation is unprecedented and it is okay not to be okay. Experiencing symptoms of stress does not mean you are weak, it simply means you're human. More techniques on how to cope better with stress. Firstly, pause, breath, reflect. As previously mentioned, whenever we are in stressful situation, our thinking processes temporarily shut down. Therefore, taking a pause would help you to think things through and to make better decisions. Secondly, pay attention to your thought. As reiterated, it is not what happens to us that make us sad, angry, but it is the story we tell ourselves about what had happened to us. Therefore, pay special attention to your thoughts. Your thoughts are not always right. Review them, examine them before you make a drastic decision. Keep to a healthy routine. Be kind to yourself and others. Reach out for help if you need it. Getting help. Let's look at where to find help. Where to find help. If you are not coping, get professional help. Contact us Wellness Center. At Jucom app, Wellness Assist. Post your full names and contact details. Or you can email us at wellness@cut.ac.za. For after hours emergency, contact SADC at 011 234 4837, or you can WhatsApp them at 076 882 2775, or you can contact Department of Health COVID-19 Response Team at 0800 029 789. In conclusion, this Chinese proverb is a summary to my presentation. It says, be careful of your thoughts, for your thoughts become your words. Your words becomes your actions. Your actions becomes your habits. Your habits becomes your character. And your character leads you to your destiny, which is the legacy you leave behind. It is very important for one to pay special, careful attention to his or her thoughts, for your thought would be the legacy that you leave in this earth. I thank you.